how do you deal with PCOS, or what are some tips around PCOS?
Sure. Well, I have a lot of polycystic ovary syndrome in my family as well as in my patients. And, generally we think that about 10% of the female population has polycystic ovary syndrome or PCOS, but my experience is that it's higher.
Yeah.
And a lot of my endocrinology friends also believe that it's more like 30% of the US population, female population. So this is an incredibly common syndrome. Because it's a syndrome, that means that it doesn't all hang together in a really clean way.
Yeah.
So, some percentage, anywhere from 60 to 80% are insulin resistant, but not all of them. If you're obese, you have about a 20-fold greater risk of having PCOS, but you still have risk if you're lean. And so what I think is important when it comes to PCOS is to realize that the treatment is primarily lifestyle.
Yeah.
I was taught the wrong model. I wonder if you were taught this too, Amy.
Yes.
I was taught, okay, this is binary thinking. If you have PCOS, the question you ask is, do you want to get pregnant or not? And if you want to get pregnant, then we give you metformin because that's going to help you ovulate. If you don't want to get pregnant, then we give you a birth control pill because that's going to protect you from having endometrial cancer. And that's just totally failed us. Like that just hasn't worked. And the number of people with PCOS has dramatically increased. Were you taught that too?
I absolutely. In fact, I was so shocked that there were so many people that have PCOS type symptoms. And we were taught that it was like this medical diagnosis and you had to be treated for it in a certain way. And when I went to India, I think I did this medical clinic and I don't know whether it was just the food that they're eating these days, but I would say 70% of the women that I was seeing had symptoms of PCOS. And it was so shocking to me because I think that this was something that we barely learned about or talked about in medical school in terms of how to manage this with diet and lifestyle.
Well, diet and lifestyle, I think, is the foundation of treatment. So we can get into some of the details of what's proven to make a difference. But just to back up for a second, the symptoms that people typically have with PCOS include irregular periods, usually every 35 days or even less frequent, acne, hirsutism. Those are some signs of having high testosterone. Having cysts on your ovaries, although that alone is not sufficient to make the diagnosis depending on the criteria that you're using. And I think what's important to point out here is that I was taught that it's mostly a problem for women of reproductive age. And what we're learning is that PCOS is a problem over the entire course of a woman's life. And I think the greatest time to intervene is probably during adolescence, and that's where we're not doing it.
Yeah.
But it's something we have to track in perimenopause and menopause especially, because we know that the high androgens, the high testosterone, the high DHEA, those are associated with the greatest cardiometabolic risk. And so I just want to make a shout out that this is lifelong. It's not just, when you're trying to get pregnant or not trying to get pregnant during your reproductive years. But maybe we could riff a little bit on some of the treatments.
Yeah.
So diet is the first thing that I go to. I like a low carb diet. Again, not too low because your adrenals and thyroid need it. But this
like
is where
low insulin, basically something that's high in vegetables, low in processed sugar, high in fiber, which we talked about prebiotic fiber because there's such a big connection between your gut and your hormones that you always talk about, that I always talk about. That's kind of, and intermittent fasting for me, just like time restricted eating, the circadian fasting style has worked wonders for people that I've worked with because it lowers that insulin level and that can do so many great things for people who have PCOS. And then you can go ahead.
Well, I agree with you. I think intermittent fasting is a first-line therapy for patients. When we look at the literature, there's not as much literature on PCOS and intermittent fasting, but there's so many randomized trials showing the benefits of intermittent fasting in terms of insulin and, as you mentioned, mTOR and, making white fat cells, brown or beige. There's so many metabolic benefits to intermittent fasting that I think it's proven enough to use it. The other piece is we know that if you reduce the glycemic index of the food that you're eating, the glycemic load, if you reduce the carbohydrates to that inside of 7 days, that can significantly reduce your testosterone levels. So that's always exciting to me that in 7 days, you actually reduce your testosterone.
Love it.
I think a lot of people get frustrated because when you're insulin resistant and when you have PCOS, it can feel like you're pushing a rock up a hill in terms of trying to lose weight. And what we know is that even a 5% reduction in weight, I care more about fat loss than weight loss, but even a 5% reduction is associated with all of these metabolic benefits. So we're not talking about, you got to lose 50 pounds or 100 pounds. Even 5% makes a big difference.